Ever pondered the intricacies of the human brain? There lies a mysterious condition known as Chiari, one malformation that continues to intrigue neurologists and medical students alike. Chiari 1 malformation is a complex neurological disorder. It happens when the cerebellar tonsils, part of the brain towards the back and bottom, descend into the foramen magnum. Now that might sound like a mouthful, but the foramen magnum is simply the large opening at the base of your skull. This displacement causes compression on the brainstem and, quite importantly, the spinal cord. This compression can lead to an array of symptoms. Headaches, neck pain, and dizziness are common complaints, while some may also experience difficulty swallowing. Yet, the presentation varies widely from person to person. Some individuals may show no symptoms at all, while others might deal with severe, debilitating pain. Diagnosing Chiari. One malformation involves a thorough review of one's medical history and symptoms. But it doesn't stop there. Imaging tests, such as MRI and CT scans, play a pivotal role in identifying the anomaly. These scans provide a detailed view of the brain and spinal cord, allowing doctors to see the exact position of the cerebellar tonsils. Now on to the treatment. The approach to managing Chiari. One malformation is largely dependent on the severity of the symptoms. For those who are asymptomatic, regular examinations and MRIs are typically sufficient. This allows doctors to monitor the condition, ensuring it doesn't progress unnoticed. But what about those who are symptomatic? When headaches or other types of pain become a primary concern, pain medication is often the first line of treatment. However, if the malformation is causing a syrinx, a fluid-filled cyst in the spinal cord, or presenting with other severe symptoms, more aggressive treatment is usually recommended. Surgical treatment may come into play here. One common procedure is the posterior fossa decompression. This involves removing a small portion of the skull to alleviate the pressure on the brainstem and spinal cord. In some cases, a shunt may be placed to divert the cerebrospinal fluid away from the brain and spinal cord, further reducing the pressure. The overarching goal of treatment is twofold: to relieve symptoms and to prevent further neurological damage. It's a delicate balance, requiring the expertise of a skilled medical team. To summarize, Chiari 1 malformation is a neurological condition where the cerebellar tonsils descend into the foramen magnum, causing compression on the brainstem and spinal cord. This can lead to a variety of symptoms, from headaches and neck pain to difficulty swallowing. Diagnosis involves a review of medical history, symptoms, and imaging tests. Treatment depends on the severity of symptoms, ranging from monitoring and pain medication to surgical intervention. The world of neurology is a fascinating one, full of mysteries waiting to be unraveled. Chiari 1 malformation is just one of the many conditions that remind us of the complexity and wonder of the human brain.